Hello, everyone, and welcome to Friends Life Care's Financial Symposium and the current session titled COVID-19's Financial Impact and Long-Term Care. My name is Joe Connor, and I am Friends Life Care's Chief Financial Officer, and I'll be moderating these sessions the next few days. Before we get started, just want to go over a few housekeeping items to ensure that you know how to fully participate in today's webinar. You'll have the opportunity to submit questions and comments at any time during the presentation by typing in the Q&A box. The presenters will answer questions either during or after this seminar. Now I'd like to introduce our speakers. And we have two speakers today. The first one is Jay Hilliard, and Jay has been a plan counselor with Friends Life Care for more than 16 years. He is an expert in the field of continuing care at home. Since joining the organization, Jay has helped hundreds of people get a plan in place to protect their future and achieve their retirement goals. Before joining Friends Life Care, he was a long-term care insurance broker for 5 years. And our co-presenter today is Kate Roberts, and she is Friends Life Care's Associate Director of Care Coordination and Provider Relations. Kate has 20 years of experience working in the not-for-profit sector. She has spent over a decade advancing the psychosocial needs of 400 residents within a CCRC community, and she joined Friends Life Care in 2017. Jay, I'd like to turn it over to you now.
Thank you, Joe. And yes, I want to welcome everyone to our presentation today, COVID-19's Financial Impact on Long-Term Care. And Kate, thank you very much for joining us.
Thank you, Jay. It's a pleasure to be here and do this presentation with you. Thank you to all of our attendees for joining us today.
Today's purpose for this presentation is really about the pandemic and how it has far-reaching effects. Not only short-term, but long-term effects. Some of these effects are known and some are unknown. As we all realize, the pandemic affects everyone, but it especially affects the older population. It's one of the most impacted groups. We're going to present some financial challenges that COVID-19 has presented all of us, directly and inseparably tied to care and how to prepare in the future for something like this. We're going to talk about how we can take preventative steps to stay healthy and well. We're going to talk about how you can ensure to have general documents in place that will help in case of an emergency in the future. And we're also going to talk about having a plan in place for long-term care. There is a way to preemptively plan for this and have a plan in place. Kate, we do have some facts and figures about COVID-19 in the older population. I know they are sobering, but I think it's important for everyone to hear about these facts and figures.
Thank you, Jay. Pandemics are real. This is not the first time our nation has had to face a health crisis. Much like the flu of 1918, all of us have been encouraged to wear masks, physically distance, and businesses, schools, and theaters have been affected. From the early weeks of COVID, the older adult population was denoted as high risk. Friends Life Care shifted our contact with members primarily to telephone and virtual visits to minimize any potential transmission with an in-person visit. We formed an internal task force to keep up to date on the wide breadth of new information and evolving precautions. Nearly a year into COVID, we continue to monitor the pandemic, the impact on our members. We have supported members through the early days when we all thought we would have 2 weeks of this and then we would move back to our normal lives. But the impact of physical distancing, restricted living, and limited access to healthcare settings has produced physical and emotional challenges for many. The wellness and care coordinators have resources for a variety of struggles and continue to support members' wellness goals, COVID concerns, and pandemic challenges. Our routine work of coordinating caregivers for members at home who qualify for care continued throughout the pandemic.
Thank you, Kate. Let's talk a little bit about realities of long-term care and how it affects the majority of older adults. When we talk about long-term care, what we're really talking about is when I think everyone realizes the very limited coverage that Medicare has for long-term care. And when Medicare stops paying, for a lot of people that don't have a plan in place, it's when they start to self-insure and also arrange or figure out where their care is going to take place. So people like to look at the probability of this ever happening to them. In the United States, 70% of people turning 65 will sometime in their life require some type of long-term care. 7 out of 10. The average for needing that care is very high. For women, women average needing about 4 years, 3.7 years in their lifetime. For men, it's about 2.2 years. Now, women live longer than men, so the probability of them needing care longer definitely exists. But a lot of these figures don't really pretend, it doesn't necessarily mean all at the end of someone's life. Care can consist of things like, as an example, a broken hip, where someone might need care for 6 months and then recover from that. And then maybe a period of time goes by and then they need care for another issue. So it can be in periods of time, or it could be all at the end of someone's life. But when the averages are out, it's about 4 years for women, about 2 years for men. Where will you receive this care? And I think this pandemic has really driven home the devastating effect of this virus in long-term care settings. More than 700,000 cases of COVID-19 occurred among long-term care residents and their staff. The death toll has been particularly alarming. Even though only 1% of the population of the US resides in long-term care facility, 4 out of 10 COVID deaths come from long-term care facilities. 4 out of 10. I know there are people joining us today that are members of Friends Life Care. There are also people that are not members of Friends Life Care. Many people that have put this plan in place with Friends Life Care, one of the comforting factors of that is the vast majority of our members, if and when they need care, receive that care in their home. Over 95% of our members that are getting care are at home. So it helps to keep people out of these type of facilities. COVID-19 and finances. We realize it has had an immediate impact on the economy, but it also has had an immediate impact on people's personal finances. Vulnerabilities when someone is retired, even before a pandemic. Just going on clockwards here, 69% of people who are retired rely on Social Security alone for their primary source of income. 23% of people retired still have mortgage debt. Many people are living on limited means, an average of $29,000 household income. And because people retire sooner than planned, 6 out of 10, these realities hit sooner than even people realized. The cost of care is high, as we all realize. And self-insuring for this can be a devastating blow to anyone's finances. Now, there's a lot of numbers and things on this chart, but I think we can just take a look at basically under the Pennsylvania one, where we're talking about 2020 costs and then projecting in the future for home health aides, for assisted living, and for nursing care. And we can see what the cost of paying out of pocket could be for that type of care. Delaware, very similar, but even a little bit higher. The startling number is the nursing home number. You can see where the projected cost of nursing homes is just going to go up and up and up. So to self-insure for something like this is very difficult. If you have a plan in place that can grow with you and offset these costs to yourself and have a plan that keeps you at home, it's a good way to at least corral these extraordinary high and growing costs. Here's another chart. And a lot of times when these kind of charts, it gets a little bit hard to really understand them all. But I think the basic thing with this chart is you can see the different events in the last number of years. The 1980 recession, a recession of 81 into 82, a recession from 90 to 91, a 2001 recession, and 2007 to 2009. The GDP changing in those times did change during those recessions. But when we get to the 2020 recession with this pandemic, the steepest quarterly drop on record, a decrease of over 9.1% in quarter two. The quarterly GDP has never experienced a drop greater than 3% since record keeping began. And here we had a 9% drop just in one quarter. So really, COVID-19 has been a wake-up call and sort of accelerated the worry that people have is an event in the economy can cause my plan of self-insuring for something like this to be very much affected. Financial vulnerabilities of retiring have definitely worsened during the pandemic. During this terrible year of 2020 that's bleeding into 2021, we have 23% of people just getting by on covering basic living expenses. 18% of people rely on credit cards if they are negatively impacted by the pandemic. Many people have not set up a financial power of attorney, 72%. And a lot of people are delaying, we've seen this a lot in the news, people have delayed medical attention even when it's needed, over 69% because of this pandemic. There is a way, as I mentioned, to plan for long-term care. 40% of older adults responding are not ready if and when they need care. 21% don't have plans if their health decline. 19% haven't even thought about it. So is COVID-19 a wake-up call? Is this terrible pandemic really an alarm bell to say, have you done everything you can to ensure that you have a plan in place for health, wellness, and care? Kate, I believe we have some recommendations for protecting yourself and your finances, what you can do now.
COVID has left few areas of our lives untouched. As wellness and care coordinators have connected personally with members by phone, email, and virtually, we have reinforced the CDC guidelines to prevent transmission. Communal online presentations through Vigor on meditation, intimacy, Medicare, even instructional art classes have kept our members engaged, informed, and learning new ways to expand their interests in a safe format. Our blog provides similar resources for fun, educational, and thoughtful subjects. Wellness and care coordinators continue to stay current on COVID precautions, area positivity rates, and individual struggles of members with pandemic worries, vaccine concerns, and navigating healthy habits. One of the functions of the annual meeting with a wellness coordinator is to review existing documents. You may have some or all of these in place. An annual review is a good practice to ensure you have continued trust in your identified agent. Life changes that can impact selections include geographic moves. Did the daughter that you selected move across the country? Would you be comfortable with remote oversight, or would you like to change to the more local daughter? Do either or both of these daughters have access to your financial institutions for bill paying purposes? If you went through a separation or divorce, do you want to keep the same agent that you had in place? Is the agent going through a separation, divorce, or already working as a caregiver to another person where their time and energy may be limited? An annual review to discuss any updates and reaffirm your selections and contact information ensures the key people in your life know how to get a hold of each other in a crisis. We are holding presentations tomorrow that will provide more detail on these subjects. Our What's in a Title presentation will contain more information about digital asset trusts. And we also have estate lawyer versus elder lawyer and savvy money habits. We encourage you to join tomorrow's sessions. Next, Jay will review the features of a Friends Life Care plan as a key component to your important documents.
Thank you, Kate. And just as a personal note, I'm also a member of Friends Life Care, and that annual review is very important for people because things tend to slip by, the years slip by, and you just don't think about it. And my wife and I have changed our power of attorney for health and for finance in the last year just because of change in our life situation. So it's very good to have that care coordinator and that advocacy as to someone keeping you on track with your plan. We thought it might be helpful to just review a little bit because, as we said earlier, there are people joining us today that are already members of Friends Life Care. And I know people do ask me occasionally to review their plan with them, and also with your care coordinator, you can review your plan just to make sure you're up to date with what exactly is in the plan. And for people that are not members of Friends Life Care, just to give you a little bit of idea about what a plan entails, especially on the financial side. We've talked about the advocacy of what the care coordinator does, but to have a plan to protect your assets is very important also. So we're going to take an example of a couple buying a plan with Friends Life Care. So that's where we have member one and member two. And you have selections. You have a plan selection, whether you would like a home care plan or a life care plan. Home care plans are designed to pay the benefit as long as you stay in your home. A life care plan, in the long-term care insurance world, they call that a comprehensive plan. It pays whether you're at home, in an assisted living, or in a nursing home. For this example, we're going to use the life care plan. You then can choose a maximum lifetime benefit. We have 1-year plans, 2, 3, 4, 5, and 7-year plans for options. Those numbers, 1, 2, 3, 4, 5, and 7, they don't start ticking when you join the plan. You can join Friends Life Care as young as 40 years old, and you can join up to your 85th birthday. The incentive for people to do it sooner rather than later is financial. It costs less the younger you join. So someone who joins when they're 65 and they buy a 3-year plan, it doesn't mean they just have the plan for the next 3 years. No, the 3 years doesn't start until they start needing care. Remember back to the averages that we talked about earlier, the average woman needing care about 4 years, the average man a little over 2 years. Gives you some idea about how people decide on their maximum lifetime benefit. No one has a crystal ball to look into the future and know what each individual person's going to need. So there's not an exact science here. So many times people do use those averages to decide what plan best fits their need. You also choose what's called a maximum daily benefit. It's an amount of money that Friends Life Care will pay per day towards your care. We start at $75 a day and increase in $25 increments up to $250 a day. That's your choice as to how large a benefit you wish to choose. In our example, we're choosing a $150 a day benefit. It's important to remember that when two people in the same household join, they each have a plan. They each have their own separate pool of money. What do we mean by pool of money? What we're really doing here is combining the daily benefit amount and the benefit period. In a 3-year period, there are 1,095 days, 365 times 3. So if you take 1,095 days and you times it by $150 a day, that is where that pool of money in the circle there comes from. $164,250 pool of money that each member has. That's the amount of money that you are protecting your own assets. You're not spending down your money, you have that pool of money. And it's important for people to remember that that money is from day one. When someone joins, they have access to the complete pool of money from day one. Their membership fee does not accumulate to eventually get to that pool of money. One of the reasons people do this on the financial side is you're creating that pool from day one. So with member 1 and 2, they each have $164,250. There's an option called private pay option. For people familiar with long-term care insurance, they call that elimination period. I really refer to this as like a deductible. There's a way to reduce your membership fee with us by taking some risk up front, like you do with any deductible, with your homeowner's insurance or your car insurance. The larger the deductible, the more your premium goes down, but you are paying that financial hit first. You are taking that financial risk first. It's the same thing with this, except it's in days of care, not an amount of money. We have many options: 30 days, 60, 90, 120, 180, 365-day private pay option. What does that mean? Does that mean for those amount of days, you will not receive the care from us? You will not receive the coordination from us? Absolutely not. Everyone receives the care and the coordination from day one. But if you take a 30-day private pay option, what it means is you are paying out of your pocket for the first 30 days. You're self-insuring for the first 30 days. If someone elects that option, they save on their annual fee. Each time the option goes up to a higher number of days, the percentage of savings is more. So some people that are joining Friends Life Care, the care coordination, the access to the caregivers, the advocacy of the care coordinator is very important. They're willing to self-insure a little bit more. They might go higher on the private pay option. We have one that's zero private pay option. In other words, we pay from day one. So it depends on what you're trying to accomplish. Your plan counselor in the process of choosing a plan will help you with those kind of decisions. The next box is our cost of living adjustment. Obviously, if someone joins and they're 63 and they don't need care until they're 73, in those 10 years, the cost of care can go up, the cost of assisted living, the cost of nursing home. We saw in the previous chart how that can go up dramatically. So you can have your benefit amount grow with you. We have two different options: 3% and 5% simple inflation, or you can elect not to have a cost of living adjustment. A lot of times it depends on age. If someone's joining in their late 50s, early 60s, it's up to 70, might be very interested in that cost of living adjustment. But if someone's joining and they're starting this program at age 80, they might be better off buying a $200 a day plan with no cost of living adjustment than the $150 plan with it. In this example, the 3% simple inflation was chosen. So if you take 3% of $150, that's $4.50. That's going to be added to your benefit amount every single year. So in 10 years, $45 extra will be added to that $150 a day. In 20 years, $90 will be added to that $150 a day. It's a way to keep up with the cost of care. The final option on the screen is the shared care benefit. This is offered for two people in the same household. It can be husband, wife, it can be mother, daughter, partners. As long as two people live in the same household, they each make the same benefit selections, then they can also choose the shared care benefit. It does cost a little bit more for this benefit, but I definitely think it's worth it. What it means is you can share and tap into each other's benefit. Let's take a husband and wife, as we've been talking about with this plan. They each have $164,250 in their pool of money. Let's say 5 years goes by after they've joined. Remember that 3-year plan hasn't started till they started needing it. 5 years has gone by. The husband starts needing care. He starts spending down his pool of money. And he just happens to use up the whole pool of money. But he doesn't pass away and he continues to need care. He now can tap into his wife's pool of $164,250. They've spread the risk over 6 years for the two of them. Same scenario, 5-10 years goes by, the husband never needs care and just passes away. His wife now inherits his plan. They no longer pay his annual membership fee, but she now has a 6-year, $150 a day plan. She only continues to pay her membership fee. That is how the shared care benefit works. I hope this review has helped people not only that are members of Friends Life Care, but people that are thinking about Friends Life Care to think about, is there a way to preemptively plan to have something in place where you can put a small amount of money away now, that if you need a larger amount of money later, you can tap into this pool of money. I want to thank everyone for attending today. We all have been through a lot in the last 12 months or so. And I think we all can agree that we are stronger when we are together. And we do really appreciate everyone joining us. Kate, thank you very much for everything you've contributed today.
My pleasure, Jay. Thank you for all of our attendees. Hope you found this information useful to you.
If anyone has any questions or want to follow up, we do have a contact information here. And we also can answer any questions if anyone had any.
Jay, monitoring the Q&A box, I don't see any questions right now, so I will leave this slide up there while I just close down the webinar. So I want to thank everyone again for attending this webinar. We hope that you're able to join us later today for one more seminar today, as well as 5 more tomorrow. A registration link to these seminars was included in the reminder email for this particular webinar that you received about an hour ago. And all of the financial symposium presentations will be posted on our website, friendslifecare.org. Once you leave today's webinar, you will receive a 5-question quick question survey. We appreciate that you could take a few moments to fill that out and provide us feedback on how we continue to improve and what types of seminars you would like to see in the future. Also, within 24 hours, you'll receive a link to a recording of this presentation. So again, I want to thank you. I look forward to seeing you at other seminars over the next 2 days, and I want to wish you a wonderful rest of your day. Thank you.
Joe, just before we sign off, there was someone that did, Roseanne, it looks like, did ask a question. I can answer it really quickly. She asked, can you change your options after you sign up? You can always change your options. However, if you want to increase either the daily benefit amount, the benefit period, if you want to add on inflation, in other words, make your plan a bigger financial plan, you would have to go through underwriting again, and you would have to sign up at the age you are at that time. You always can downgrade your plan. You can go down at any time, but to go up, you would have to go through the underwriting process again and also pay at the age you are when you do change the plan.
And to the other question in there, that the whole presentation will be made available on our website within the next 24 hours. And that's all we have. Thank you very much.
Thank you.
Thank you.